Hey everyone, thanks for clicking on this video. My name is Nick and I'm the Program Manager for Healthcare here at Nex Cubed. Now, if you are familiar with us, we work with startups and corporations to bridge the gap between innovation and outcomes. And I'm here today with one of our esteemed subject matter experts, Jerry Kolosky, who is the former Senior Healthcare Advisor for Strategy and Policy and Business Development at Panasonic. And he's here today to discuss some of the things that are happening in healthcare around policy and regulations due to COVID-19. Now, Jerry, I think it would be an understatement to say that COVID-19 has really impacted the healthcare space in today's world. Some of the things that have happened really specifically around telehealth are super interesting, and I'm wondering if you can dive in a little bit more and explain what's going on in this arena.
So Nick, clearly the COVID pandemic is acting as a catalyst, in my opinion, for a new and enduring age of telehealth. So for instance, over the last 2 months, COVID has driven a radical transformation from in-person healthcare delivery to telehealth. Let's define that. Specifically, the use of technology to remotely monitor a patient's health status, to support triage and clinical decision-making, and to conduct medical examinations at a distance. In recent weeks, the pace of regulatory change, and more importantly, the real-world implementation of these new policies and practices has moved more decisively than the prior decade. And that was a period marked by continuous advocacy within the policy community and sustained marketing efforts by digital health innovators and legacy technology vendors alike. So as our nation continues to respond to COVID, the benefits of telehealth are clear. So telehealth facilitates care coordination across settings of care, provides clinical care for COVID patients within their home, and allows patients with non-COVID related health issues to receive care without the risk of exposure. So in terms of policy and regulation, to your question, in my view, there are 3 relevant components at play. General policy and regulation governing reimbursement of telehealth, grants and additional financial incentives that are available to providers and innovators, and mandates for interoperability between digital health systems and the legacy electronic medical record.
Now, Jerry, that's super interesting. And I really want to double click on one piece here. Now, why don't we begin with policy? What is really happening on that front?
Nick, first, CMS has radically expanded telehealth benefits for Medicare beneficiaries. So under this new policy, Medicare will now pay for remote telehealth encounters in medical settings across the country, including within the patient's home. That represents a big change. Meanwhile, the FDA has expanded the range of devices via which a physician may provide telehealth, and the HIPAA safeguards governing the management of electronic health information have been conditionally relaxed for the duration of the COVID crisis.
Now, Jerry, you also mentioned grants. From the perspective of digital health, who's going to be the beneficiary here?
So Nick, a wide variety of federal and state level grants and other financial incentives are being offered to promote the rapid adoption and ongoing utilization of telehealth in response to COVID. So these are primarily aimed at physicians and provider organizations, but digital health innovators are the indirect beneficiaries. For instance, under the COVID telehealth program, the FCC has provided over $200 million in funding to doctors and hospitals to provide telehealth services now to high-risk, underserved populations.
Now, Jerry, it might be obvious for those of us who've been in healthcare for many years that the lack of interoperability within EMRs has long created a barrier that's difficult for us to innovate within digital health. Now, what can we do to reduce and overcome this barrier and work within interoperability?
Nick, you're absolutely right. The lack of interoperability has produced a fragmented environment that's characterized by data silos and a lack of care coordination. So in response, the Department of Health and Human Services and the ONC have recently issued a powerful set of new guidelines mandating the free exchange of electronic health information between patients, providers, technology vendors, and health plans. So these mandates are intended and in fact will promote better system-wide outcomes and ultimately foster innovation in digital health.
Thanks, Jerry. As always, I really appreciate your insights, and it's a pleasure to work with you, and I hope to see you again in person soon. For our viewers, thank you so much for watching this video. And if you'd like to reach out to me, please feel free to send me an email at nick@nex3.com. I'd love to have a conversation around how we can help you innovate within digital health. Thank you so much again for your time.